Good morning, everyone, and thank you for joining us for this University of Calgary series, webinar with our experts, Overcoming Anxiety in Schools. My name is Kelly Johnston, and I'm your moderator for today, and I'll introduce our experts in just a second, but we want to do a couple housekeeping things. So this webinar series is about our scholars and the research that they're doing here at the University of Calgary. You can submit your questions throughout the webinar. You should see a screen right on the front of your computer. You'll notice that we're glancing at our computer a lot instead of at you, and that's because that's how we see the PowerPoints as well. You can keep the conversation going live on Twitter using the hashtag ExploreUCalgary, and you can ask questions throughout the webinar, but I want to be honest, we've got a lot of people on today, and we might not get to all your questions, but we're going to do our very best. So let me first introduce Daniel. So Daniel Coppola-Sibley is with the Matheson Center for Mental Health Research and Education, the Hotchkiss Brain Institute, and the Alberta Children's Hospital Research Institute. He's an assistant professor at the Cummings School of Medicine in the Department of Psychiatry, and we're going to be talking a little bit about his research, what he's learned, and also current research that he has underway. Dr. Gabrielle Wilcox is an associate professor at the Workland School of Education. She's also a member of the Hotchkiss Brain Institute, the Matheson Center for Mental Health Research and Education, and she's a registered psychologist who has also done some work in the schools. So we're going to hear a lot about your experience there. Now, before we get too far along, we want to know a little bit about you, because that helps us direct some of the questions and understand a little bit more about who we're talking to today. So please check off all of the things that apply to you, parent, educator, researcher, student, while I talk to the experts for a second. So Daniel, tell me a little bit about joining the University of Calgary. How long have you been with us?
So I started my position as an assistant professor on October last year. So I've been here for just a little bit, just a bit over a year now. Yeah, I've been, moved to Calgary from New York City, and I did my PhD before that at McGill University. And yeah, I'm really excited to be here, and USC has been extremely supportive in supporting my research and getting that up and going.
That's fantastic. We don't hear a lot of people coming from New York to Calgary, so we're very glad to have you. Gabrielle, what about you? Give me a little bit about your background and how long have you been with the UCalgary team?
Yeah, so I've been here almost 6 years, and I came from Pennsylvania, so also from the East Coast, and I was in practice before I came here.
Okay, excellent. And big transition, like now full-time research and teaching as well, so a lot on your plate. So let's find out who we have with us today. A lot of parents, not a surprise, right? We're talking about anxiety in schools, so people are concerned about their kids, I'm sure. Educators as well, that's excellent. A few researchers, great. And quite a few people who are anxiety sufferers themselves. So hopefully we're able to add some tips for you today on how to cope with that, how to help your kids. As well, you may notice on your screen a link to resources. There are a number of links there that I know you're going to want to check out after the webinar. So let's get started. Daniel, maybe you can walk us through what you're about to talk about.
Sure. Oops. Sorry about that.
It's okay.
So today I'll be talking briefly about sort of how common is anxiety, especially how common is anxiety in teenagers, and how common is it in girls versus boys. Talk about what is anxiety, the different types of anxiety, a bit about where anxiety comes from, and we're going to give some brief sort of tips and advice on how to help anxious students. And I'll also be talking a little bit about sort of the neurobiology or the brain bases of anxiety.
Okay, great.
So anxiety disorders are actually the most common type of mental illness at any age, so in adults as well as teenagers. We know that amongst children and teens aged 9 to 17, roughly 13% of them will develop an anxiety disorder at some point. We also know that girls are more affected than boys. Girls are somewhere between 1.5 to twice as likely as boys to develop an anxiety disorder, and we'll be talking a little bit about some of the reasons for that. We also know that anxiety disorders can coexist with a range of other mental health issues, such as depression, and physical health conditions as well, such as chronic illnesses, chronic pain, things like that.
Now, before we go on, I do want to talk a little bit about, a lot of people say anxiety is the new biggest mental health concern. Like, we're hearing a lot more about it. In both of your experience, do you think that there is more, or are we just hearing about it more often?
Right. So we know from epidemiological research that the rates are not really actually increasing. The prevalence of anxiety disorders has stayed about the same for the past couple decades. I think there's just a lot more recognition about it. There's somewhat less stigma about it, so people who are dealing with these are more likely to come forward and seek help. So really, I think it's more so increased recognition than it is an actual increase in the rates of anxiety.
Gabrielle, would you like to add to that?
Yeah, and I think maybe schools are more aware of it, and the way that it's being shown in school-age kids. So when I was in practice, I had huge numbers of kids who came in with anxiety concerns, especially around school and attending school.
Excellent. Yeah. Okay, and I know you're going to talk a lot about that stigma in schools
and
stuff coming up. Okay.
So it's particularly important to understand anxiety disorders and mental health in general in teenagers and children, because we know that of the people who will ever develop a mental health disorder at any point in their life, roughly 3/4 of them will develop that before the age of 18. So really, it's that adolescent period is characterized by the first lifetime onsets of these disorders. So it's really important to understand why children and teens are at risk for anxiety. Indeed, the Canadian Council on Learning has pointed out that poor mental health in Canadian school children poses a significant risk to their academic development, puts them at greater risk of things like dropping out of school, developing substance abuse problems, and even suicide or suicidality. Because, while most teenagers go to school, schools are well positioned to be at the vanguard of public health strategies designed to prevent and detect mental health disorders among young people. So, very briefly, this is something of an oversimplification here, but sort of at the core of anxiety, regardless of the type of anxiety you're talking about, people who are really prone to it tend to overestimate that something bad is going to happen. They tend to, we sometimes call it catastrophizing. They think that definitely something really, really bad is going to happen to them. And then sort of the other half of that coin is that they often underestimate their own ability to deal with it if that did happen. So, for instance, you might have a student who is overestimating that they're going to do really badly on a test or they're going to fail an exam, and they're probably, again, they're overestimating. In fact, based on their past grades, they will probably do pretty okay on it. And second, they're overestimating, how well they'll be able to deal with it if they did do badly on a test. They might forget that they can make up those grades in other ways, or that there's other tests that will make up, pull their grades up, things like that. So anxiety is often characterized by sort of overestimating something really bad is going to happen and then underestimating your own ability to deal with it.
And I guess, where's the scale in, what's normal? Because that sounds pretty normal, right? We all go through those anxious periods
Sure.
and stuff. So is it just one thing that you're concerned about or anxious about, or do you find it's an overall experience for the child?
So for people with sort of a genuine anxiety disorder, sort of like a diagnosable clinical anxiety disorder, well, first of all, there has to be sort of clinically significant distress or impairment. It's causing problems in their day-to-day functioning. We also know, now it depends a bit on the type of anxiety, but if you're looking at, say, generalized anxiety disorder, that involves worrying about multiple things, or multiple areas of their life. So it's not just, they're really concerned about their exams, but they might be worried about grades, plus their health, plus their friends, plus a range of other things. So it's not usually circumscribed by just one topic or issue.
Okay.
So briefly, like Kelly was alluding to, anxiety is normal. We all experience anxiety and we all worry at various points. But red flags should go up when those feelings become excessive, thoughts become potentially irrational, and everyday functioning becomes debilitated. And so anxiety disorders can be characterized by excessive feelings of panic, worry, fear, or rational discomfort in everyday situations, to the point that it's causing people problems in their functioning. So this also is an oversimplification of the neurobiology of anxiety, but various researchers using brain imaging techniques such as magnetic resonance imaging scans have identified the amygdala and the prefrontal cortex as two regions that are very involved in anxiety. The amygdala is kind of deep in your brain, and it sort of automatically generates emotional responses to stress and to threats and to scary things and whatnot. And it kind of does that without your control. It does that just sort of automatically. The prefrontal cortex is kind of at the front of your brain. That's really where you do your thinking, essentially. So it processes incoming information, it helps you plan decisions and behaviors, and these two structures are linked, and the prefrontal cortex sort of, you can imagine sort of something scary. If you see a scary movie, your amygdala will react to that. But as adults, our prefrontal cortex will basically sort of tell the amygdala, like, no, it's fine. There's really nothing here to be actually that afraid of. You're not really in any danger here.
So where's the disconnect, or do we know? Like, where's the disconnect when it's kind of bigger for some people, when those anxieties aren't those normal ones that you just respond to and ones that affect your life so much?
So it has more to do with the, sort of the development of this circuit. And one thing in teenagers is that these two regions are connected, but in teenagers they're not connected in teenagers the way they are in adults. So teenagers don't have the same ability in their brains to sort of regulate their emotional responses to stress in the way that adults can. And this is something that develops over the course of the childhood and the teenage years, and really is only fully developed by your sort of early or mid-20s. But we'll talk a bit more about the sort of implications of that in my next slides. So just briefly, some other origins of anxiety. Children and teens can often learn that the world is a scary place. They might have really negative experiences with family or with friends. Other people can model for them that you need to really watch out. Bad things are going to happen to you, or sometimes bad things do happen to them, and it teaches them that the world is kind of a scary place. And along with that, they can learn that they might not be capable of handling those things. We also know that some individuals are somewhat predisposed based on their temperament or their personality. Some children are just more prone to kind of fearfulness and anxiety. And that temperament has its origins in both genetics or their genes, as well as the things they experienced growing up. So there are certain kids who are more vulnerable to anxiety based on their kind of underlying temperament. So there are various factors that contribute to the rise in the rates of anxiety disorders in teenagers. As I mentioned, there's this ongoing rapid brain development. In terms of the brain's not fully developed until you're an adult. This is part of the reason why many psychiatric disorders first appear in adolescence. But on top of that, adolescence is a really, really unique period for people. Friends and social relationships take on a new importance that they don't have in childhood. Teenagers start dating. We know that a stressful romantic relationship or the end of a romantic relationship is a major stressor in teens' lives. This is probably the first time in their life that they're dealing with increased academic demands. There's a new workload on them that they haven't had before. And on top of that, they're dealing with increased independence and autonomy from their parents and just more responsibility in general. So this is sort of so they've got this sort of combination of these new stressors that are being piled on them, but their brains aren't really fully developed to deal with these new stressors. So we suspect that sort of a combination of these factors that contributes to that the increase in anxiety in the teenage years. As I mentioned, girls are 1.5 to twice as likely to to develop an anxiety disorder in adolescence. And so, some early evidence suggests that differences in sex hormones might account for this, but there's also additional research is definitely needed in this area. They also face unique kind of social pressures. So, for example, their bodies are maturing at that age. And it's also because they're starting to date, there's more pressure on them in the form of media and the things they see on TV and movies and whatnot. Similarly, there's evidence that girls often are more likely to base their self-worth on kind of the friend and romantic relationships that they have in their life. But this is also the period where they start to experience things like bullying and people not being romantically interested in them. So that can sort of put them at increased risk for anxiety disorders as well. But the reasons for why girls are more likely to develop an anxiety disorder are very complex and multifactorial. But we do know that girls who experience an anxiety disorder in junior high school, while we know that they tend to report more anxiety, and this is associated with decreased academic engagement, poorer grades, and things like that. So it's important to understand why girls are more at risk for these factors, for these issues. just to follow up on that.
Mm-hmm.
So just beyond school failure and academic disengagement, we see higher rates of absenteeism, more disruption in the classroom. They have trouble completing basic tasks, and they might struggle to complete homework. It can cause stress within the family, and it can cause impairments in their social and romantic relationships.
We have a couple of parents that have asked us about anxiety and like when it leads to like a bigger concern, like a suicide concern.
Mm-hmm.
And are kids being honest with us, like, are telling us? My own experience with my teenagers is they often weren't talking to me. So is there something we can offer parents for how to cope with this when they are concerned?
Yeah, I think it's really important for if you can see those signs that your child might be dealing with substantial levels of anxiety. I think more often than not, if that kid is feeling really down or even thinking about hurting themselves, more often than not, they're not likely to come forward with it. Sometimes they will, and that's great, but I think it's up to parents and teachers to some extent to try to recognize the signs of anxiety in kids and sit down with them and have a talk about how are they really feeling? Like, is this just stress, or is it extreme levels of worry, and are they having any thoughts about hurting themselves in some way?
Did you want to add to that, Gabrielle?
Yeah, so I think having conversations with school personnel is really important because they see a whole world of this kid that parents don't see. And so seeing differences between student behaviors in the school environment and the home environment is an important kind of factor in understanding how kids are functioning.
So treating it as a whole community
Yes.
of care.
Yeah.
Okay.
So, what does anxiety look like? Well, students may feel a sense of dread or fears of impending doom. They might seem agitated or on edge or highly distracted. They might vocalize their worries and say that they're really stressed or worried about it, but oftentimes they won't. They might have feelings of some bad thing or catastrophe that they actually can't articulate. Oftentimes, people with anxiety feel really, really worried, but they have a lot of trouble putting their finger on what is it they're worrying about. Oftentimes in kids and younger teens especially, anxiety can manifest as more somatic or physical complaints, so like headaches, tension, upset stomachs, things like that. And sometimes, not always, but sometimes that can be a sign that this kid is really anxious. Because often kids and adults don't even recognize that they're anxious. And
Yeah.
that's what's causing them to feel this way.
So you might want to be writing some of that down and kind of keeping a journal or something of when you're noticing it to try to keep all those together.
You could. That's certainly something a therapist might recommend. Yeah. So I'm just going to quickly go over the types of anxiety. I already kind of alluded to generalized anxiety disorders. So this refers to just worrying about at least two different areas of your life most of the time of the day, most days out of the week, to the point that it's causing you problems functioning. PTSD, post-traumatic stress disorder, typically follows exposure to a major traumatic event that often was very threatening to the person. So it can be a physical assault or a natural disaster or the death of a loved one. They tend to relive these memories over and over. They tend to avoid situations that are reminiscent of them. For example, someone who's in a car crash might have extreme anxiety over getting back in a car. They might feel emotionally numbed, and they might have trouble sleeping. They might experience nightmares about the event. And they can often feel irritable and have poor concentration because of this. Panic disorders are a little bit different in that they're characterized, they come on very, very suddenly. They peak within, I think, 15 minutes or so, and they often dissipate shortly after that. They're very hard to understand for the person because the person doesn't, there's no particular trigger. They can't sit there and say, okay, it's this thing that made me anxious. They often just have a really strong feeling of impending doom, that something really bad is going to happen, and it seems to have come out of nowhere. A lot of people have specific phobias, so a lot of people are familiar with these. Fears of spiders, dogs, heights, closed spaces, or open spaces for some people. The only point I want to make about that is that it's really normal for how many 12-year-olds will say oh, I'm super afraid of spiders, but like a genuine spider phobia might look like they're unwilling to enter a room because they saw a spider there in the past, or they're unwilling to go on a picnic because there might be spiders there or something like that. So it's not just a fear of it, but it's like a fear that is causing problems in their functioning and in their day-to-day lives.
Okay, before you go on, I want to go back one slide. We do have a couple of questions. For general anxiety disorder, is that the same as a clinical anxiety?
Yes, so I mean, clinical anxiety is really just an umbrella term that refers to, you've sort of met a certain number of symptoms and a certain level of severity of your symptoms, but the nature of the symptoms determines what type of anxiety disorder you have. So generalized anxiety disorder is characterized by, the fact that it's general. So you're worrying about multiple areas of your life, and it's not like a specific phobia where you're just afraid of a particular thing, but you're really prone to worrying about a wide range of stuff.
Okay, and one more question. Does the severity of your anxiety correlate with when you're diagnosed? So we have somebody asking, I was diagnosed quite young, and does that mean that like my anxiety is worse than anybody else's, or does that have any kind of relationship?
I wouldn't say inherently no. You can be diagnosed at any age, and it can be more moderate or it can be more severe, but I don't think that when you were diagnosed is necessarily related to how severe it is.
Okay.
Not necessarily, anyways. Finally, social phobia. These individuals are really concerned about being judged or scrutinized in social situations to the point that they might avoid socializing, for example. So that can obviously have harmful effects on their relationships with friends. Some youth and children suffer from separation anxiety disorder. So this is an intense fear that if you're away from your parents or caregivers, something bad is going to happen to them and you won't see them again. So these kids often are very scared to go to school because they're worried something will happen to their parents while they're gone, or they're very afraid to, say, stay at home while their parents go out because they're worried something bad might happen to their parents and they won't see them again. And then finally, obsessive compulsive disorder. These are individuals the persistent recurring thoughts that kind of compel them to do some sort of repetitive behavior to make those thoughts go away or to get rid of that anxiety. So, probably the most well-known one is fears of contamination and germs, and people might be washing their hands, dozens and dozens of times per day. And this can end up taking up, hours out of your day and causing real problems in your life. So just a few tips on sort of helping anxious students. As I kind of mentioned before, even teens themselves often don't recognize their own anxiety as anxiety. They have a feeling that something is wrong and they're not feeling so good, but they don't realize that this is anxiety. So it's important for parents and teachers to teach them about anxiety, teach them that anxiety is normal, although it can become excessive. On top of that, anxiety is not dangerous. A lot of people think that if they get really anxious, they're going to faint or pass out or throw up or die. Sometimes your heart can beat so fast because you're anxious that you think you're going to have a heart attack. So it's important to learn that anxiety is not dangerous in and of itself, although it causes problems. And in fact, there's evolutionary reasons that we become anxious. We can talk about fight or flight mechanisms later.
Gabrielle's going to talk about that.
Right. Yeah. I think it's really important. Do not dismiss or minimize their worries. I think it's very easy as adults to look at, say, a 14-year-old who's really worried about this relationship or this friend or this test, and we think, well, wait till you're an adult, you're going to have way bigger problems. But they're 14, and this is a big problem.
It's a big problem
for them.
Yeah.
So don't be dismissive or minimizing of that, and try to remember, especially for teachers and parents, it's often sometimes teens with anxiety are very distractible. They might have trouble completing their work. They might have trouble concentrating. They might have trouble following instructions, things like that. But it's their anxiety that is causing them to disregard those directions. It's not an intentional desire to be difficult or to be oppositional to other people. I think maybe Gabrielle will talk about relaxation techniques and other sort of therapeutic approaches. Other more specific things in the classroom, you can work with children regarding class participation and answering questions on the board. It might be too much for a teen to just give a half-hour talk. They might start with something slower. And it's important. A lot of anxious teenagers, even if they're perfectly good at the topic or good at that class they're taking, they might be really afraid of answering questions incorrectly. Small group interactions and assistance can help increase their feelings of competency and help them to develop better relationships with their friends. And it's really important to talk, if you're trying to intervene with teenagers, it's really important to get feedback from them. Is this helping? And then finally, when teens are making steps towards dealing with their anxiety, it's really important to positively reinforce that. Let them know that they're doing really well. Highlight for them what they've been doing that's been helping them. And probably most importantly, a lot of people with anxiety want to avoid the things they're afraid of. And while that might feel helpful in the short term, it's really not helpful in the long run. And it only reinforces those anxieties because you learn that if you can only feel safe if you don't do the things you're afraid of.
Right.
So that's not helpful in the end.
And that's kind of hard for parents to hear, because I think that, your natural instincts are protect,
Mm-hmm.
right? But you really do have to let go a little bit for them to get to grow up.
Or even sort of gently nudge them.
Okay.
In
So
that
encourage some
direction.
of the behavior instead. Okay.
And I'm not saying, drop them into the deep end.
Yeah.
But, sort of gently nudge them in the right direction.
Okay,
Yeah.
thank you. And I know, so Gabrielle, we're going to hand it over to you. We have a lot of people asking questions about school, but we'll maybe let you get started, and then we'll add the questions in as we go. Okay, so thanks.
Did you want to?
There's a slide about my research.
We'll come back to it
Sure.
at the end. Let's
Sounds
do
good.
that. Okay.
All right, so the areas that I'm going to talk about are mental health and anxiety in schools, mental health stigma related to schools, anxiety around that transition when you're leaving the safety of high school and moving into the adult world, and then cognitive behavior therapy as a treatment for anxiety. So I purposely put mental health and anxiety together because, as Daniel had mentioned previously, there's a lot of comorbidity. So lots of people with anxiety have other mental health problems as well, or people with other mental health problems have symptoms of anxiety even if they don't have an anxiety disorder. And as he also mentioned, it's quite common. So I just have a representation here about maybe a typical classroom, 25 kids, and you're likely to have about 5 kids who are having some kind of mental health problem in your classroom. So as a teacher, that's an important thing to understand. This kind of symptomology that kids are bringing into your classroom that's going to affect the way that you interact with them is an important thing to know, so that you can kind of be aware of what you're dealing with in your classroom.
Yeah, and just before you go on with the classroom, like I've heard from a lot of my friends concerned about having their kids labeled in some way. So is there any advice you would offer that way? Like when you're saying like be open about it and talk about it, like is there going to be something on the other side that I'm not going to be happy about?
Yeah, so I think part of the challenge is that idea of stigma, which we'll talk about later, which has made sometimes labels seem bad. But partly, as Daniel had mentioned, sometimes kids don't know what they're feeling, right? And so having a label can help you understand and kind of have control over it. And then it also opens up and lets you know what treatment options are likely to be best for you. So if you don't have that label, it's not going to open you up to maybe getting a psychiatrist or a therapist. So there are important reasons why we have the labels, and removing the stigma associated with those labels is a really important kind of journey that we've been going on as a society.
Okay.
All right, so Daniel talked a little bit about some of these already, but kids who have mental health problems are really prone to lots of other things. So making sure that we identify them early and provide good supports is really important to minimize some of the other later challenges that kids can face. Additionally, of all the kids who have a mental health challenge, only about a third of them actually get access to services. And that's really problematic, that 66% of kids who really need services aren't getting them. And of the third who are getting them, about 70 to 80% of them get them through schools. So schools really are a good place to think about how we can support teenagers and kids with mental health problems, because they're there, and it's a really good place to provide those kinds of services.
Well, and a couple people have asked, like, who do I talk to at the school? Is this a conversation I have with the counselor, with the teacher, with the principal? What does that look like, and how do you start?
Yeah, so I think schools have different kind of vehicles or avenues that you access those services. So the first one, especially in elementary school, would be to talk to your teacher. At the high school level, talking to the principal would probably know if you have a guidance counselor who's available and has that kind of training. And if not, can you access a social worker or a psychologist in the school? And if not, they at least have ways to access you to the mental health services outside of schools through Alberta Health Services. So there should be some kind of avenue, whether it's within the school or they're connecting you to services outside of the school that they can at least be a liaison for.
Thank you.
Yeah. All right, so as you mentioned with the label issue, there is a big challenge right now with stigma in schools and within our greater society. So stigma really are these beliefs and attitudes about mental health and mental illness that lead to negative stereotyping of people and prejudice against them and their families. And it's important to note that the stigma can also be internal. So you can have stigma about yourself having a mental health illness that then impacts how you view yourself as a human and your willingness to seek services. So in schools, some research has shown that about 50% of school-based mental health providers see stigma as the biggest barrier for kids getting services in schools, but even more teachers and students see this as a barrier. So about 70% of teachers and students see stigma as being the biggest barrier to kids getting help. So it's really an important area that we continue to address and minimize. So through the Brain and Mental Health Neuro team, we're working on a study right now in a local school district looking at an anti-stigma program. So the program we're using is Headstrong, which is really interesting in that it makes kids be the leaders of this. So kids from different school districts come together for a summit and learn about mental health and stigma and hear firsthand experiences from people who live with mental health problems. And then they kind of brainstorm about how they can take that information back to their school and make a plan to reduce stigma in their schools that fits with them. So the students are the leaders rather than some outside person coming in with a curriculum and shoving it onto the schools. The kids take that leadership role.
And having those champions is really important, isn't it? Because it even teaches other kids how to be more accepting, I think, when you're hearing it from somebody, a peer.
Yeah, and kids are often more willing to listen to their peers who they value than to adults. So during high school, it's a time sometimes of conflict between kids and adults. And so having other peers who are saying this is important and we don't talk about people that way is a really powerful way to change behaviors rather than teachers saying we don't talk about other people that way.
And I know a lot of people are going to be interested in this research. So when do you expect to be sharing it?
Yeah, so we are hoping to have some of the beginning research around the qualitative information that we got from teachers and parents about their views of stigma in the schools. By mid next year, we're hoping to submit it. And then by the end of this school year, we're planning to be done collecting our quantitative data. And so hopefully then within the next year after that, we'll get it all sorted out and have some papers ready. Yeah. All right, so another area of transition, so Daniel talked about that transition to high school is hard. The transition out of high school is also quite challenging for kids. So some of the things that add to stress for this is moving. So lots of kids move away. So this is the first time they've ever been away from their family, and often they move away from their friend supports as well, which is quite challenging for them. They have an increased workload, so the amount of reading that you have to do in university is much, much higher than it is in high school. And there's this double-edged sword of freedom, right? So maybe their parents were always on them to do their homework, and now they're not. And so they have to figure out, how important is this to me, and what do I need to do to be successful? And that's a hard transition for a lot of people who are entering university. And related to that, mental health challenges are common in university students. So they have higher rates of reported distress. So one study in a survey of how distressed do you feel, almost 84% of college students said they were feeling distressed, where 29% of the general public who participated in this study said that they were feeling distress. And again, females have higher rates of anxiety, which continues into university. That impacts how they're functioning. And in a general screening kind of study, more than a third reported at least some symptoms of mental health. So it's definitely something we need to take seriously in university students. And in a study that we recently conducted here at the U of C, first-year students who had higher rates of reported anxiety had lower GPAs. So having those anxious feelings can interfere with your productivity and being able to make good choices for yourself. And unfortunately, lots of those university students who report high levels of distress don't seek help. So we need to make sure that we're making it really easy for students and, again, removing those barriers of stigma so that they feel like it's a safe thing to go seek help. So we mostly talked about the negative aspects of anxiety, so we wanted to talk a little bit, too, about the things that you can proactively do to support people who are anxious. So the first line of defense for anxiety is CBT, or cognitive behavior therapy. Sometimes it's used in combination with medication, and medications are often prescribed for those acute anxiety. So when it's really intense, some people can't benefit from CBT, and the medications help with that. However, I want to put clearly out there that you really need to talk to your physician and therapist about the best combination of therapy and medication for you or your child.
Yeah, and I think before we go on, there are a couple of questions around this, and like, when is the right time for medication? Like, is there ever a right time or a right approach? What would you advise?
Yeah, so typically if it's extremely intense anxiety that's feeling overwhelming, where you can't even think about talking about your problems, or you can't even think about doing something about it, that's a really common time when you would need it. Also, if you start doing therapy and the therapist and the child is thinking maybe you need something more, those would be some of the entry points into medication.
We have a couple of people asking, like, well, we're focused kind of on those school ages. Is anxiety being diagnosed before that? Like, are they showing signs of anxiety as young toddlers?
So that's an interesting question, and we do know that. So I mentioned that that some kids are sort of temperamentally predisposed towards anxiety. We do know that sort of how a kid is temperamentally, so even in early childhood, like at the age of 3, correlates with their temperament, in their teenage years. So these things, they often show signs early on. However, it doesn't necessarily mean that kid has sort of clinical level of an anxiety disorder. But often people don't go from totally calm and no worries at all to severe anxiety disorder. There's usually some pre-existing symptoms, but that maybe aren't really interfering with their life, or maybe they have some sort of really new stress that kind of amps those up in some way. But there is typically something pre-existing before they develop sort of a diagnosable anxiety disorder. But that doesn't mean that they actually had clinical levels in the past either. So it's really sort of case by case, but often, there are sort of pre-existing kind of subclinical symptoms.
And maybe, Gabrielle, you can answer this one. Like, for kids as they're growing, we're hearing that you could go in and not have anxiety, and suddenly it could develop.
Yep.
Can it go away just as easily, or is it difficult to go away without treatment and interventions, and will it stay then?
Yeah, I think it's quite variable, right? So some people can have a specific life situation that kind of provokes the anxiety, and sometimes when that ends, the anxiety symptoms will go away, and sometimes it doesn't go away without treatment. So I would say if it's at the point where it's clinically diagnosed, it means that it's interfering with your functioning, and so you probably should be seeking treatment because you're not sure if it's going to go away on its own, and it's interfering with your functioning. So you want to get supports in order to have resources to cope with it.
Thank you.
To add to that, just want to highlight the importance of sort of getting help earlier rather than later, because sort of the longer that the anxiety disorder goes on for, and the longer any mental health issue goes on for, the harder it becomes to treat. So seeking help, especially, or if you think your teenage child might have one, it's important to talk to them and get help quickly.
Yeah, and I think you brought in the good point about the physician. So that's probably not just the schools. You probably should be having this ongoing discussion with your physician.
Yeah.
Okay, great.
Okay, so we'll talk a little bit about CBT, or cognitive behavior therapy. So some aspects of this you can even kind of think about using preventatively. So as a parent or a teacher, you can use some of these strategies. However, that's different from actually implementing the therapy. So I think it's thinking both, right? So you can support your kid by using some of these principles, but if they have diagnosed anxiety, you need to see a professional who can go in more depth on these.
Well, and it's interesting because we have a parent that's asking, so when is it the tough love encouragement to get them to do something, and when is it like I need to back off? So this parent's giving an example, like, my child doesn't want to go to school, so when do I push so hard?
Yeah, so sometimes it's not as much about pushing so hard, but providing the supports that the kid needs in order to get there. So as Daniel had talked about, not pushing them in that deep end, right? But you know what? Maybe they need some swimmies on their arms, or maybe you need to hold their hand while they're doing this. So it's not always forcing them, but giving them whatever kinds of supports that they need in order to take those steps to do what they need to do.
So going with them to school, maybe, like walking them in? Or
Maybe.
like...
So this is one where I think it's for school refusals because of anxiety. Having a psychologist who helps you make the plan is really important.
Okay.
Because that would be what we call exposure therapy. So putting them in the experience that they don't want, and there's lots of scaffolding processes that you need to do to make sure that they're successful. So you want to have each step be something that they can do and experience that success, that I can overcome this anxiety before you take that next one. And eventually you'll get to the point where they go to school independently, but it may take a while to get there.
Okay, thank you.
Yeah, so in CBT, the idea is that our thoughts and our feelings and our behaviors are all connected. And so if we intervene in any one of those areas, we're going to help improve our outcomes. So if we think about thoughts, Daniel talked earlier about the idea of failing a test, and that's a really common kind of fear that kids have. So we have these things that we call thinking errors, and thinking errors kind of pop up like those unwanted ads on your computer all of the time. You can't stop them. They just, boom, they're there, and they're annoying. But eventually, if you see some of these, you start to believe them without even knowing that you're believing them because you see them so often. And we do that to ourselves. We say these things to ourselves over and over again, and we start to believe them. So an example of catastrophizing about a test would be a kid who says, I know I failed that test. I bet I will fail the whole class. I won't even pass grade 10, and then I'll have to drop out of school and live in my parents' basement forever. So if we look at that logically, that doesn't make sense. Right? So even if you are true that you are going to fail that test, the chances that that means you're going to live in your parents' basement forever is not highly likely. So if we're going to start to change our thoughts, this is an area where we would change our thoughts. And so some people start to think of it as being this Pollyanna-ish, if I just think good thoughts, it will be better. But CBT isn't that. It's really being logical about our thoughts. So if you were the student who really did study hard, you can say, you know what, I know I studied hard and I'm prepared for this test to counteract that thought. If it's true that you're not prepared for that test, you can still change your thought and have it be accurate and say, I don't think I studied enough for that test and I probably earned a poor mark. But I can ask my teacher for help, and I can set aside more time to study next time so that I am prepared. So again, it's taking back that control instead of spiraling into that catastrophe of living in your parents' basement forever.
And this is, this is kids, this is us too, right? Like anybody having an experience, this is good information to
all
try to
cognitive
re-talk ourselves, right?
Yeah. And it's important to kind of know them and catch it, right? So you can go, oh, that's a pop-up ad. Right? That's something that's not true, that's just trying to distract me and interfere with my functioning.
So if you were going to walk a child through that, like if you know they're saying, like, I failed this test, and they might not go to the basement part, but like life's over.
Yeah.
How would that conversation look? Can you give me an example maybe? Or a date broke up, or, like I've broken up with my boyfriend and life's over, or my girlfriend.
Yeah. So sometimes I'll go back to a past experience that they had where they have been successful. So maybe this isn't their first breakup, right? So remember when the other kid broke up with you and you felt like your life was going to end. And they can say, yeah, I did. And it was really hard for a long time and it didn't feel good. But you were strong enough that you were able to overcome that. So sometimes going back to past experiences where they didn't think they could do it and they did can be a good way to enter that kind of conversation.
Excellent. Okay.
Okay, so the other part we can look at are feelings. So we can't just go in and change our emotions. So telling people not to be scared, anxious, worried, or intensely alert is not going to help them at all because they probably already tried it, right? They probably already tried to say to themselves, don't be worried, don't be worried, don't be worried. And that doesn't change anything. But we can work on changing our physiological feelings. So when we're anxious, our body starts to get ready, as Daniel said, to either fight, freeze, or fly. And so we have our increased heart rate and we sweat and our stomach starts to do crazy things. And those are important if we're facing a real threat right now. But if we're not, we can do things to kind of calm down those physiological responses. So we can practice progressive muscle relaxation. So where we intentionally learn to control our muscles, we can change the way we're breathing, and that can help lower everything down. So those are some things that we would do in therapy to teach kids some strategies to take control over their responses.
And do you find that we're moving away from kind of a medication place to a more self-help place? Or can we never say, like, don't do that? Like,
Yeah, I think you really need, there are some people who will need medication and some people who won't need medication and can engage in CBT kinds of tasks to treat their, yeah, so I think it has to be an individual basis based on that person, where they're at, and what kinds of supports they need to be successful.
Okay.
All right, so as I mentioned, anxiety is helpful. So if we see this grizzly bear out in the wild, it would be really bad if we weren't anxious, right? We will die. The bear is going to kill us. So we need to have that heightened awareness and be ready to either run away from the bear, maybe fight the bear, or play dead if we need to. And so it's really important, again, to focus on that anxiety is good. We need anxiety to stay safe. What's the problem is if we approach things that aren't that dangerous and treat them as if they are. And that's when anxiety becomes a problem. So if we go back to the kid who thinks that if he goes to school, his mom is going to die in a house fire, right? And so he's not going to school, he's refusing school because he's really terrified of this thing happening. And if we let him stay home from school and nothing bad happens to his mom, he starts to believe nothing bad happened to my mom because I stayed home from school. And then that strengthens that desire to stay home because that is the only reason my mom is safe today, is because I didn't go to school. So that's why it's important to make some kind of plan to get the kid to go to school or to take that test or to do a public speaking event, because the more we avoid it, it does feel good at first, right? We have that immediate relief of our anxious feelings, but it strengthens then that anxious response next time we face that situation.
And I know you've mentioned like it's really good to involve that psychologist in that plan.
Mm-hmm.
But you know, as we've mentioned, resources are scarce. So are there good, I know we've got a big list of resources, but even off the top of your head, like something that parents can do in that step-by-step maybe place between getting that help from that psychologist and helping their child get over the presentations or get over the things that are impacting their lives?
Yeah, there's one really good book that I like by Tamar Chansky. It's called Freeing Your Child from Anxiety, and she gives parent advice that's based on CBT. So it's the kinds of things you can do as a parent to support your child based on CBT principles.
Excellent.
Just another resource,
please.
maybe more readily accessible as well, is Anxiety. There's an organization called Anxiety BC. So Anxiety British Columbia, and they provide a range of sort of self-help materials geared at either adults or children and teens on their website. And there's useful, education and exercises and worksheets and things like that that can be very helpful for people.
Yeah, I think that's on our list.
Oh,
Excellent.
I think
Okay,
so.
thank you.
All right, so the key takeaways from my part of this talk was anxiety is common in both children and anxiety, and that anxiety increases other risks, so it's important to intervene early and support kids. Schools are a really good place to support kids, so whether it's having an anti-stigma program, having some just preventative kinds of things around school climate and engagement in schools, and then as much as we can, early intervention with professionals in schools like school psychologists and licensed social workers can definitely support kids in being able to access their education to the fullest. And then finally, there are multiple options for treatment, including medication and therapy, and that it's important to really talk to professionals to make the right choice for you or your child.
Okay, I've got a few questions now. Like let's leave it on this tip sheet for everybody for now. Is there any benefit showing for therapy dogs for kids with anxiety? Have either of you had any experience with that?
I'm not familiar with the research on
either.
therapy dogs.
I would be willing to bet they're helpful in the moment, but probably not a long-term solution.
That's
that would
good.
be my best guess.
And what about supports for families with kids with anxiety or that? Is there, something out there that's for them, maybe separate from what you're helping your child with for you to cope?
I'm not familiar here, but in most places there are family support groups, and so if your child has a mental health problems, it is a really stressful time for a family, and it is important to make sure that parents are having good self-care for themselves so that they can take care of their kids. Because if you are so stressed out and worried about your kids, you're not going to be able to be a good support for them. So the more you're taking care of yourself and your relationship, if you're married, the better you are going to be able to support your kid.
Okay.
I don't know the titles of any books off the top of my head, but I know there are various books written about sort of being in the household of someone with a mental illness, whether it's your spouse or your parent or your child. So I'd encourage people to take a look online for those. I just don't remember the titles off the top of my head.
Okay, excellent. And I know that we're talking about kids right now, but and cannabis is illegal if you're under 18, but it's a big talk right now. We have a few people asking about cannabis. A lot of kids experiment at that age. So one, does it help them or does it hurt them, or what would your advice be?
So I'm not an expert on cannabis, but I do know there are studies that suggest that the teenage brain is quite vulnerable to the effects of cannabis. So it's not a really good idea to experimentally take it. So it would be one thing if you were prescribed some kind of oil or medication from cannabis by your physician, but to just go to the store and buy a joint and smoke it to feel better probably isn't your best bet to treat anxiety.
I'm also not much of an expert on cannabis and mental illness, but we do know that cannabis use rates are higher amongst people who have histories or currently have a mental illness. One thing we don't really know is sort of what's the direction of that effect. Are people who are prone to mental illness just more drawn to using cannabis, or is cannabis actually causing those mental illnesses? But generally speaking, there is not much strong evidence for cannabis as a long-term treatment for anxiety, although it will certainly reduce anxiety for most people anyways, or for many people in the short term. But it's pretty unclear if that's a really viable treatment option in the long term. But I think those studies are ongoing.
Okay, thanks. Somebody asking about research here and asking if there's any information or studies on how early intervention with anxiety in children can alleviate or even cure anxiety as they enter adulthood. Any
Sorry,
thoughts
can you repeat
on
the
that?
first half of the question?
Any information or studies on how early intervention with anxiety in children can alleviate or even cure anxiety as they enter adulthood?
Well, I mean, there's loads of evidence, like for CBT, that's that Gabrielle talked about. It's an effective treatment. It's not going to be, it's not 100%. It's not going to help every single person who receives it, but it does help a big chunk of those who get it. And especially, if that anxiety is detected early and treatment is begun fairly quickly, there's lots of evidence that anxiety in teens, it's a treatable problem, certainly.
Yeah, and related to that, part of the benefit of CBT is that you're gaining coping skills. So one of the reasons that it's effective after the therapy ends is that you have skills now that you can use whenever you need them. Whereas something like medication, you need to keep taking that. So that's why usually medication is combined with the CBT, because then you are learning new ways to handle your stress and new stressors that come up. And you have, again, to remember that Daniel had said that it's that combination of thinking that this problem is so big and that your resources are so small. CBT brings your resources up here and helps you change the way you think about this. And so then it makes it so that you feel like you can overcome the problems that you have.
And maybe that helps with a question that we've had, because a parent is asking, like, if you put your child on medication, will they ever get off of it? And that can be a fear for people, right? I don't want to sign them up for their life, but maybe we have to. I don't know. So how would you respond to that?
Yeah, so from my understanding, typically it's combined with therapy, and then eventually you start to wean them off of the medication as they're able to begin to use the therapeutic tools that they're gaining.
Anything to add with that?
Oh, just, I mean, there might be a small percentage of individuals with anxiety disorders who end up staying on medications quite long term, but hopefully that is a small minority. So I would agree most people end up getting off them at some point at least.
Okay.
Yeah.
And are there any side effects people should be aware of, or is that, again, a discussion with their physician and
Yeah,
stuff?
because it would depend on the medication, yeah.
Okay. And negative thinking patterns in general, people are kind of asking, like, what's the difference between, like, kind of that negative thinking pattern, like having those thoughts, and that anxiety? Maybe you can just go over again, like, what signs are we looking for when it's become a problem in my life, the anxiety?
Yeah, so we all have some of those negative thinking patterns, but as you saw from the example that I gave, sometimes they're pretty extreme. So when your thinking starts to be so extreme that it paralyzes you, that you're not able to function effectively, that's really the red flag. So it's that functioning. Yeah. So you need to have impaired functioning to have a clinical diagnosis, and so that's when you really want to be concerned.
Yeah. And when the kind of catastrophizing is sort of to the point that it's extreme and somewhat irrational. So, I mean, saw someone once who was worried. This is an adult, but he was worried that if he made a mistake at work, someone would notice it. If someone noticed it, they would tell his boss. If his boss found out, he'd get fired for making just a mistake. If he got fired, he'd have no income. If he had no income, he wouldn't be able to support him and his child. If he couldn't do that, he was going to end up homeless with his son on the street. This is sort of
his reality.
Typical,
Yeah.
like extremely catastrophic to the point of being fairly irrational type of thinking pattern.
And that would be hard to be experiencing that every day.
It would be,
Like that
yeah.
would be so much weight on you,
Yeah,
right?
exactly. Yeah.
Yeah, so it's different from those teenagers who would often make that kind of statement, right?
Yes.
But then they don't kind of keep going with it, right? So lots of, oh, my world's going to end because I did bad. And then they move on and their life is fine, which is different from somebody who, my life is going to end, my life is going to end, my life is going to end. So I think that's some of the difference. So I think lots of teenagers will say these kinds of things, but then they really move on and are fine. It's if they're not moving on and are fine and are perseverating on these thoughts, that's when...
And you're starting to notice those extra pieces, like you said. And yeah, okay. And I know I want to give some time to Danielle to just talk about his study. So just put it up here before we have to go.
Oh yeah, thanks so much. So the research that I'm running right now, we're interested in recruiting families who have a teenage child at home. Now what we're looking for here is families where one or both of the parents have a history of depression or anxiety, whether you have ever been formally diagnosed or you just sort of strongly suspect that you've had these disorders, because we do know that the children of parents with these disorders are at elevated risk for developing it themselves. But we're looking for families where the teenager has not had a diagnosable episode of these disorders. And what we're going to do is we're going to try to follow them through their teenage years to see who in these high-risk teens actually develops a clinical depressive or anxiety disorder. And we're looking at what factors determine or predict that. So we're going to be looking at things like brain functioning, hormones, life stress, parent-child relationships, peer relationships, a whole range of things to see if we can identify who's going to develop anxiety or depression for the first time in their life. Okay. So we're actively recruiting for this study. So if anybody is interested, there's a URL there where you can use that to send us your contact information, or you can contact my lab coordinator, Shania, at the email address or phone number on the slide.
Oh, that's fantastic. And Gabrielle, like you said, your results from the school study will be shared widely, probably some results early in the spring and then end of
That's what we're hoping, so hoping.
Excellent. Okay, I know it doesn't always happen the way that you'd like it to, but thank you so much.
Yeah.
And of course, your research is supported by a number of different organizations. If there's anybody you'd like to mention.
I should thank the Matheson Center for Mental Health Research and Education, as well as the Hotchkiss Brain Institute, the Alberta Children's Hospital Research Institute, the Social Sciences and Humanities Research Council of Canada, and the Brain and Behavior Research Foundation.
Gabrielle, anybody you'd like to say?
Yeah, so also HBI and Matheson, and additionally, our Brain and Mental Health Neuro team was supported by a grant from the University of Calgary.
Excellent. Okay. And thank you so much for sharing your research with us today. We really appreciate it. And I would encourage everybody, I know we didn't get to everyone's questions, and we certainly apologize for that. We did our best. These slides will be available. I know a lot of people are asking, will the slide deck be available? We'll be emailing them out to you. You may also see a survey question on your screen right now. We'd like you to take that for us if you don't mind. You will be emailed these slides, as I said, and a link to this recording. This didn't have to be live, so if you have friends or other family members that you think would like to hear what we've had to say today, please let us know. And you can sign up for other webinars. Go to exploreucalgary.ca. And if you have any ideas for us about webinars that you'd like to hear or hear about research that we're doing, please let us know. Thanks so much for joining us today, and have a wonderful afternoon.